are offered both over the Spectrum Health app and also through their desktop website. In addition, Mandy Moore, the director of Spectrum's Health Virtual Operations, gave us insight into the fact that virtual health has been around for years, but in March, COVID was sort of a catalyst that had brought it to the forefront. And now Spectrum Health would like to have 50% of their visits primary care be online and 25% of their visits specialized care be online. And while furthering our understanding of the solution and problems, we found that virtual visits in the last 6 months have actually plateaued in their growth, and they haven't seen much change since early March.
First off, we just wanted to thank all of you and say that we recognize all of the hard work that everyone within the Health Pointe system has put into the virtual care program. The overall layout of the platform and app is very well organized, and we can all agree that getting to your appointments and to your records is very apparent and easy for the consumer. We also wanted to add that we see the advancements that have been made since March, such as the evolution from only allowing the usage of mobile to now allowing the usage of desktop, which makes the virtual care even easier. And even the providers that we have spoken to, such as Dr. Fox, Dr. McCown, and Dr. Rollinson, have agreed that virtual is nice because they can see their patients at ease in their own homes while reducing the risk for infection. And also, it's more convenient for each of the patients because they can do it on their own time, even in their busy lives.
In order to reach our conclusion, there were several different activities that we did to find the solution that we thought made our driving question the best. To begin with, Michelle did an amazing job of being involved with us, and she was able to give us the maximum amount of information possible. Because of her, we were able to contact several different healthcare employees who we were able to ask further questions and become more familiar with the virtual healthcare system. She also was able to link us up with a couple of healthcare providers who walked us through a first-hand demonstration of a virtual healthcare appointment. From there, we did what was called an empathy map. This is where we split up into groups and were forced to look at things from a more holistic perspective of the doctor, the patient, the physician, and the people who work in the tech department. For example, if I was the doctor, I might feel either excited about virtual health being expanded because I might have more flexible hours and be able to be at home more, or I might feel a little bit disappointed about virtual health being expanded because maybe I want to be in my office and physically see my patients. One last thing that we did to reach our conclusion was the sticky note activity. This was where we isolated ourselves in a room and brainstormed our own solutions for a limited amount of time. And after this, we came together to reach a compromise of a more plausible solution for our driving question.
So the biggest solution we've got is that we have to have better marketing. Right now, the demographics who are going to use virtual health more, especially in the future, right now are not being targeted very well. As well, we need to look at the older adults too. We can market to the younger ones, but right now there's not a lot of older adults who are very familiar with virtual care, even though many of them were really interested in it. So going to a place like Pointe to educate them on that is a good idea as well. If we're going to have a larger virtual care program, you also need to have an expanded tech department. So that's something we thought of. And we also have a provider incentivization plan to get the doctors to want to do virtual care as well.
Okay, so Michelle, you can finally open that white package that we dropped off yesterday and distribute the contents of the envelopes just so everybody can either see and understand what's inside of them. So for anyone who is not there or will not be able to see them, we created different designs, and we have 2 different styles of pins in 2 different sizes, and then also 3 different designs for a standard size piece of paper. And we thought with these prototypes, you could apply them internally because internal marketing seems like the best solution to increase the amount of people who are using your virtual platform. You serve 22,000 people, and that's a lot of patients that you could flip over to virtual, especially like high touch points, like the kiosk when you come check in would be a great place to hang these banners. Or it's not just on the providers, but it's also on the people at the front desk, the people at kiosk, or anyone else to be wearing pins as a point of contact to increase brand awareness for your virtual platform. In addition, looking at this graph, that Manu shared with us during our presentation on some of the data behind virtual is this graph is about all of the age group relative to how much virtual visits they take up. So the bigger the box, the more virtual visits they take up. And one thing that we found was very, very interesting was that people from 18 to 25 and 5 to 17 use your virtual platform less than people aged 56 to 65. Obviously, those two demographics are highly tech literate and will be able to use your easy to use platform. Now, we thought the best way to reach these demographics would be through social media expansion. So currently we understand that you do have a Facebook, but we would suggest considering options like Instagram or a small video sharing app called TikTok. In addition, we know and understand that you have a YouTube, and also using that for community outreach is another good idea that we thought you could integrate into your marketing plan.
Looking at the numbers, we saw that older generations did make up a large portion of virtual visits, so we asked ourselves why. No hands-on education. Older generations aren't as tech savvy. We propose working with places right here in Grand Haven. Places like Pointe, a wellness center for older adults that provide numerous services, as well as the Villages at Rosie Mound, a community for senior living and assisted living. And guess what? I already reached out to these places, and they're very excited for the potential partnership. And I can pass along those contacts. Implementing an education program at these places will increase the number of virtual visits. A class that teaches people how to attend a visit and walk away with the best possible experience. This class could be taught by someone or taught by a Health Point employee. And additionally, the class or the places could have a room that the patients could go to and have one-on-one assistance with their visit. Additionally, there could be devices provided so there is no longer a technology barrier.
Another thing that we suggest is more like stuff addition to the tech department. First off, there is already a system for feedback from providers, but if we are increasing the number of virtual visits, that's going to lead for more problems. So a better way to get feedback from the providers would be very beneficial because problems would be better, like you can find the problems to solve easier that way. Another thing is an enhanced tech department. With the more virtual visits happening, that's going to lead to more problems, more technical error on the provider and the patient. So having a branch of the tech department that just works with virtual or just strictly more people working in the tech department will allow for those problems to get solved quicker.
Incentives are a way to motivate and encourage patients to choose virtual. An incentive for your patients are to have earlier appointment options. When scheduling a patient's next appointment, they would be presented with two options, in-person this day or virtual. The numbers are higher for in-person, so the idea is that patients will be seen sooner if they choose virtual. This will jumpstart the transition to having more virtual appointments.
So you also have to incentivize the provider, the doctors, to want to do virtual care as well. And so we created a list of possible incentives you could give doctors individually to want to do more virtual visits. One of them is simple. It's just monetary bonuses per virtual visit conducted. That would be an easy thing to get some attention to virtual care early on, as well as reducing the gap between the reimbursements. I don't know how your compensation structure works exactly. I do know that doctors are being compensated for in-person visits much more than they are for virtual visits. And if you close that gap just a little bit, that might incentivize them and motivate them to want to do more virtual visits. And providers who stay within a high percent of annual virtual visits could also get bumped to a higher compensation range later on. So this is something that would happen over a period of a year or two, far out in the future. But providers who show an interest and desire to do more virtual care and show that they're good at what they do, this would be a great way to get, especially the younger, maybe less experienced doctors a pay raise, and that can motivate them to do virtual as well. Now, we did receive some feedback on this idea that some were afraid that possibly the culture in the building may be kind of ruined. It could possibly be inhibited and might not work very well with doctors and everyone else involved with virtual care. So what you can do is you can create a building-to-building competition. One of the ways you can do that is just recognize that the providers are super competitive. If they don't want to be with each other, you can bet that they're going to be willing to compete with other buildings through Spectrum Health and not just Health Point. If you post a leaderboard that shows the weekly visits done virtually per building, this is a great way to get them to see how they stack up compared to other buildings around them. Who has the highest proportion of virtual visits compared to in-person visits? And if you can't do them building to building, you can just do it for yourself as well. It's a great way to motivate people to get better and to raise the proportion of virtual visits to in-person visits. With that, everyone can get involved in this. Training super users who are doctors to work in office is going to greatly boost the productivity and bridge the gap between moving in person and virtual. There's a lot of doctors who are less experienced with virtual care. There are also a lot of doctors who know what they're doing already, and having those doctors available in the same room so patients and providers can share the information that might infringe on HIPAA privacy laws is a great way to bridge that gap and to create a more seamless transition between in-person and virtual care.
As a way to formalize these solutions, we used the NUF test, which stands for New, Useful, and Feasible. I learned about the NUF test during last year's futurePREP'd. It's there to help ensure that our ideas would be the most beneficial to Health Point. Following these guidelines made certain that our ideas have never been done before by your facility, that they're practical and cost efficient, as well as easily implementable.
Thank you so much for listening to our presentation, and also thank you for the opportunities that you gave us when